really appreciated. Oh, here we go. Let me push. Okay. Okay, wonderful. So thank you everybody again for joining us in this CoC information session. These are always amazing to have because we do learn a lot about our providers and what they do and how they serve our community. So it's always really exciting to have everybody presenting. My name is Daisy Correa. I am the CEO of the Homeless Leadership Alliance. And with me, I have Victoria Kelly, who will be popping in every once in a while, and we will be answering any questions that you may have as we go along. Some of the presenters lined up for today will definitely take on some Q&A after they've finished their sessions and the presentations. So today we're going to really focus in on Pinellas mental health, generational shelter, stabilization, substance use, and treatment resources. So I am really excited about that. Outline here is our agenda that we have for today. We're going to have some presenters discussing mental health, shelter, stabilization, treatment resources. We have the Caring Community Counseling presenters, Golden Generations, Inc., Salvation Army from St. Petersburg, West Care, Turning Point, and then we'll have some Q&A around 6:40 and some public comment, and hopefully we will be closing 6:55, 7-ish. Thank you. Next slide, please. As always, we like to remind everybody to become a member. If you haven't become a member of our Pinellas County Continuum of Care, this is our nice little QR code that you can go ahead and open up on your phone. Applications or brochures are available as well on the CoC website. And if you have any questions or concerns that you may have regarding membership for the CoC, we have Victoria Kelly's email as well located on the bottom. Upcoming membership meeting schedules are set for November 12th. The location is still to be determined. We have upcoming CoC information sessions. They're scheduled for October 8th and December the 10th. Okay. Oh, sorry. So with our first presenter, hopefully they're here. I think Victoria already checked in on them. I would like to introduce Amber Callahan with the Caring Community Counseling Center.
Okay.
Amber.
Hi, I'm here. I'm so sorry. I feel like I was having so many problems, so I apologize about that.
It's okay, technology. I hope I pronounced your last name correctly. I apologize if I didn't.
So later I'll tell you that you didn't, but it's Amber Calhoun, so you're close enough. Close enough.
Hi, everyone. Apologize.
No problem, no problem. Hi, everyone. My name is Amber Calhoun. I am with Caring Community Counseling, and I'm here today just to tell you guys a little bit about our homeless support program. So you can go to the next slide. All right, awesome. So first, let me start with just who we are. We are a community-based mental health center. We are providing services in Pinellas, Pasco, and Hillsborough County. However, we do have brick and mortar locations in St. Petersburg and Pinellas Park, as well in Newport Richey. All of our Hillsborough services are provided. They are all community-based, so we are going out in the community, whether that is at home, in different partner agencies where we have hubs, or we are going into the schools, as well as, again, into just different locations that are private. We are, of course, a community-based mental health center that provides full mental wellness services, so that's full wraparound services. And we're dedicated, of course, to serving our community. So today we're going to be talking about that program and what we've done with different community partners to continue to ensure that we are helping the homeless to succeed. Our mission, of course, is just to always empower. We want our community to just make sure that they're stable, they're healthy, and they can independently thrive in our community with personalized care, because we treat every individual based off of their needs. Next slide, please. All right, so what does that look like and how do we serve? So we start by, again, right now, whether we're going into organizations or they are coming to one of our locations, we first coordinate entry. That is just determining what the needs of the individual is, how long they've been homeless, as well as what we can do to help them transition and what would be best fit for them. We have different community partners where we are doing placement. That's all different types, whether that is an ALF, whether that is a nursing home, whether that's a transitional living facility, whether that's a substance use program. We have a full list of organizations that we are coordinating entry for. What we do, a lot of the time individuals are homeless because they need their mental health evaluation. So we ensure that that is the first thing that we do to ensure that the client, first of all, is placed in the agency that can support them and they have the right level of care. And they can, once we place them, they can stay that way into going into a permanent housing solution. And then we also ensure that if anyone needs their medication or they need continuing behavioral health, whether that is therapy, whether that is psychiatry, targeted case management, or whatever that might be, we ensure that we put a individualized treatment plan together to ensure that they have that. Most of our cases are in need of targeted case management, so we provide our members with a targeted case manager that will help them to navigate the services they need, whether that is coordinating doctor's appointments that are outside of us, or signing up for benefits, or whatever those services might be. As well as we help individuals that do not have insurance or do not have coverage to ensure that they do have that coverage to support, again, what their needs are. So whether we're verifying the insurance or helping them sign up for insurance, we ensure that wherever they are knows that they have the necessary benefits to ensure that we are supporting them. One of our great things is that we have about 40 practitioners, and that's medical doctors, therapists, case managers. We have bachelor's level practitioners as well. So we are booking our appointments within 7 days. That's usually at all times. So we hire every single month. So our team for the month of September will go from 40 to 47 providers. Next slide, please. All right, awesome. How can you contact us? So we get all the time, people want to know how they can send over a referral or how they can contact to see how we can begin coming into their facility or them sending individuals over. So on our website at www.caringcounseling.org, there is a referrals link where you can just say you don't have time or you have cases that you have to send over after hours. You can send over through that referrals link, and we are contacting whomever sent the referral or the member themselves within 24 business hours. We talk to them about what they need, and we normally schedule a time for us to come out or for the individual to come to us. With those appointments, if it is someone that has insurance that it covers their transportation, we also coordinate that transportation through the health plan. And then another way that you're able to send referrals over are via fax, or of course you can send it directly to our referrals email. For all the partners that just prefer us to pick a day and come into the facility to see members, they just, of course, just email myself. We will set up a meeting and discuss what works best for you, what works best for us to come out for services, and that includes all services. So the partners that we go into now, the services that we bring to them are behavioral health evaluations, of course, targeted case management. We bring psychiatry, as well as therapy services. So we can bring, again, our team can come in and we kind of create somewhat of a little hub, but we choose the day, the time, and then we coordinate appointments based off of the members that you have for us to serve on that day. Last but not least, we do have some individuals that might need records to coordinate care as we're coordinating their transition into permanency, and they may need records. So this is the email to get our records for the services that we provided, or just to contact to know, hey, this person that I sent, did they complete that appointment? As long as we have the necessary information, you'll be able to allow us to answer those requests through our records department. Now, I know that I talk fast, and I know they gave me a little time. Let me tell you, I'm winded, so I could have been here for a couple hours. So I was talking very fast just so I can leave the 2 minutes for questions that I might have. So does anyone have any questions that I can answer for you? And then if anyone wants to set up anything offline, of course we can. But does anyone have any questions?
Yeah, I have questions.
Yes.
Hi, Amber. Thanks. My name's Joe Ponafino. I'm the director at Pinellas Hope, the shelter, and some permanent supportive housing programs. And I believe Victoria might have referred me to you a while back, and I don't know if I ever followed through. So I'm really glad to hear what you have to offer. And I'm just trying to get a little bit of clarity. You said a couple things like help placing clients into ALFs and skilled nursing facilities.
Yes.
Do you actually help with the placement?
We do. We do. So we help with the placement. So whether they, lots of clients, they need a specific document that's completed by their primary care. So
Right.
that entry document, we first from the very beginning ask them when's the last time they've been to their primary care. We
Right.
make sure that 3008 is done.
Right.
We ensure that the placement is available at the ALF or the nursing home. And then we coordinate the whole thing. So we communicate a lot of the time with the admissions coordinator, and then we ensure that the pickup is scheduled once they are approved.
That's great. I've had some success with a skilled nursing facility lately, Aspire. I've been working with them, and but this has been a hard nut to crack for a long time.
Yeah.
So we have a lot of people here who need higher levels of care. So I'd love to touch base with you some more and see what more we can talk about with that. Also, the actual counseling and therapy that so many of our clients here at the shelter need. It's so easy to get them in to see somebody where they'll prescribe some medication, but what they need more is some real therapy. And that is something that you also provide?
We do. So we do have therapists that will go in the community. They provide virtual care. We have some that don't want to talk in certain settings. So we do have an option for virtual, but we do have therapists that provide that therapy to them as well.
Yeah, I'd love to follow up with you. I know the time is short and there's other people that might have questions and stuff, but I would love
Yes.
I'll reach out to you and
Okay.
see where we can go with this. So I really appreciate you being here, Amber.
All righty, Joe. Thank you so much. I appreciate you as well.
Yeah.
Does anyone else have questions?
Amber, there was a question in the chat. Where is your office in Pinellas Park?
Our office in Pinellas Park, and so you guys are aware, it will not be there long because we're transitioning to Clearwater, which is not far. It's like 8 minutes away. But in Pinellas Park, it is on, it's 5130. Oh gosh, my mind just went blank. 5130 78th Avenue. So we're in a plaza in a very I don't know, just away from the road area that we are going to be moving it to Clearwater. However, both ways, like our St. Pete office is about 13 minutes away from the Pinellas Park office, and the Clearwater office that we're transitioning into, if I'm not mistaken, is 14 minutes away. So we're going to kind of find that midway point for our North County members that, yes, that's it. We're going to find that midway point. So for everyone that is looking for the Pinellas Park location, just make sure that when you come through for your admissions, you let us know and we can direct you for the next, I want to say 45 days. After that, it'll be our St. Pete or our Clearwater office.
Excellent, thank you. We also had Thalia with a question. Thalia, did you want to come off mute?
Yes, thank you so much. My quick question is for Amber. I am new to the area, and I'm turning like a couple homes in Pinellas Park into an ALF. So how will I be able to get on like your roster for like ALFs to refer clients to? Because right now I currently do a medical respite program in Pinellas.
Yeah, Thalia. So thank you so much. Great question. So we do let's set up an appointment for a meeting. So we do go out and we visit all facilities first. We learn about what your processes and your services that you offer to ensure that we are always referring the proper level of care. And then we do ensure that if they're receiving therapy, if they're receiving psychiatry, that they'll be able to continue with those services. So again, we come in, we have a conversation, we make sure We visit all sites and we make sure that we're, if we continue to refer, we're open to continue those site visits because we love to, first of all, we love success stories, as well as we just always want to make sure that if there are any changes that you have, if you have new locations, we stay up to date on that. So we can set up time for us to connect on at your site.
Okay, good. Because I actually need a group therapy for my veterans right now as well. So
Okay.
yeah, it'll be nice for us to set up a time to talk.
Yeah. So I'll make sure I get your contact information and we'll set that time up.
Thank you.
No problem. Thank you.
Excellent. And for anybody who didn't grab it from the slide, of course, it is still on there. Amber's email was put in the chat. I'll put that again as well, just to make sure that everybody has it handy, because it sounds like there are a few organizations that might need your assistance, Amber.
Yeah, absolutely. So anybody, I am more than happy to, again, like I said, I love to eat and I love to talk, so we can do that at the same time. And we can set up a time for us to get together and I can explain, or if anyone has any questions where they didn't get to add tonight, just let me know. I will wait for everyone's contact information and I'll reach out. Joe, I'll reach out to you. Thalia, I will reach out to you and just let me know if there's anybody else who wants me to reach out or they want to reach out to me. My email is in the chat, or you can just drop your email as well and I will be reaching out. I'm going to say tomorrow morning, but knowing me, it'll probably be tonight at like 12:30, 1 o'clock in the morning, because I don't sleep. So just let me know. Let me know.
Thank you, Ms. Amber. Amber is going to have to leave and will not be here for our Q&A session at the end. So before she does head out, are there any other questions? Of course, you can reach out to her via email as well, but are there any other questions while she's with us today?
Yes, I'd like to have her email or a number that I can get in touch with her.
Absolutely, Phyllis. That email is on the screen and in the chat. And then we will also send it out via email and make sure that everybody has all of the resources that we have shared here today as well. Thank you very much for asking.
Okay.
All right. Well, in that case, thank you very, very much, Amber. We really, really appreciate you taking the time to share this important information with us.
All right. Awesome. Thank you so much. I appreciate you guys.
Thank you.
Thank you. Didn't mean to go that way. There we go.
I was like, you're going backwards. Thank you so much again, Amber, for that presentation. So up next, we have Golden Generations, and we have Juanita Suber, who will be presenting with us today.
Okay, good evening, everyone. My name is Juanita Suber. I am the co-founder and CEO of Golden Generations Incorporated. Victoria, I want to thank you for offering me this opportunity to present tonight to talk a little bit about who we are and what we do. So I'm going to be deviating from the slides. I just wanted to give Victoria a little visual today. So we may be kind of deviating from the slide. So a little bit about Golden Generations. We're a 501c3 organization here in St. Petersburg, Florida, specifically in South St. Petersburg, Lake Maggiore Shores. We were born in 2003, and from that time have done various programs with youth and seniors through intergenerational projects. And the purpose of that is to bridge the gap between our youth and seniors, which we feel is very important for both of them to thrive, to help them think about, social responsibility, to look out for one another and care for one another. And in that brings together a community. This symbiotic relationship of respect and mutual understanding, we believe is very important for our communities to thrive. We have our 4 pillars of care, which is housing, education, workforce development, and senior support. Although we've done a lot of programs, mentoring, tutoring for youth and other programs for seniors, we have 3 programs that pretty much epitomize the work that we do with these 2 populations. One, we have our Career Readiness Project, where we work with youth from 14 to 21, offering career readiness projects, in entrepreneurship workshops. We do case management, referrals for any support that they may need for young people in the community. My Sister's Place project, we have a home for young women who have aged out of foster care, ages 18 through 21. We provide them with social skills, with budgeting support, various housing, employment assistance, and mentorship. We bring them to the community, and we bring the community to them to provide that support for them. Over the years, through the My Sister's Place program and our Career Readiness Project, we've had service about 650 youth. Our last project, which is our Senior Connection Project, we work with seniors who are 55 and older, providing them with grocery shopping, homemaking services, mental health support. And oftentimes, the youth who have completed and successfully completed our Career Readiness Project, we will hire them to provide services to seniors in our community. A little bit about kind of how we've evolved over the years. You can go ahead on to the next slide. I think I'll move forward with that. Yeah. So with My Sister's Place, we opened up in 2018. We actually had to rehab for about 2 years, gutted out a house here in St. Petersburg, Florida. And we were blessed with this home through the Pinellas County Board of Commissioners. This is where we work in the South St. Petersburg area. So we had 23 referrals from 2018 through last year. And of the 23, 11 young women received housing and supportive services. Of the 11, 9 of the women graduated with a diploma or GED. And let me just go a little further than that. They all graduated with a diploma. Okay. So not anything against GED, but that is something that we strive for our young women to have them get a diploma. 7 of the 11 women continued on to pursue higher education through technical school or college. 9 of the young women transitioned to stable housing. So we have a 2-bedroom, 2-bath home. And one of the things that makes My Sister's Place unique is that we have an on-site resident support specialist that provides them with that additional support that they need. For instance, they come home having a bad day, they have someone to talk to, and this person kind of emulates what good behavior looks like, helps them with their budgeting, teach them cooking. We have cooking classes and things of that nature. So as a matter of fact, we are in the process of hiring a resident support specialist, and you can get that information. We'll show our website at the end of this slide of this presentation. Let's see what we have next, Victoria. That's it. So those are I call them our 3 pillars of love: our career readiness, My Sister's Place home, and our support for seniors in the community. That ends my presentation.
Thank you so much for that. Let me see. I don't know if there's any questions. I didn't see any on the chat. Does anybody have any questions for Ms. Suber?
Yes, yes, good afternoon, Ms. Suber. Who and what is your ideal client?
These are young women who are aging or have aged out of foster care. Typically, they're 18, just aging out of foster care, but sometimes we have young women who have aged out. So they have aged out. They have been in foster care, and their ages 18 to 21, at risk of homelessness. And they have to want to be a part of this program because we do a career plan, which they help us to develop. We monitor that career plan and that their progress on a monthly basis. So they have to be willing to want to get the support and need the housing. And you could call us, send us an email if you have a young lady that you think would fit into our program. And we'll be glad to speak with her. We do interview them just to make sure that they are willing to participate. They may not be able, because we provide the tools for them, to transition to adulthood. As long as they're willing, we're willing to accept them and welcome them into My Sister's Place program.
Juanita, there was a question in the chat from Ms. Lauren Smalls. Can folks get support through Golden Generations without housing?
Yeah, well, we do, now it depends, are you talking about youth, seniors, or both?
Let's answer for both.
Well, we do have our career readiness projects, and we do offer that for youth 14 to 21. We provide case management services to them, mentorship. We just finished a project through our United Way grant where we had 43 youth that were involved in our career readiness project. We talked to them about intergenerational wealth. We talked to them about finances, and what we do is we do a continuum of care. Once they finish that particular project, we will follow them along, maybe 3 months, 6 months later, to ensure that they're using the tools that we gave them, or if they need some support moving forward.
Excellent. We do still have a couple of minutes with Ms. Suber. Of course, she'll be here for the Q&A later as well. But does anybody else have any other questions about Golden Generations or My Sister's Place? Juanita, one thing that I always find really interesting that y'all do is, and I know you talked a little bit about it, but the generational support that you do where you have young folks working with and assisting our seniors here. I think that that is really interesting. And that is essentially kind of a homeless prevention and companionship program for seniors. Is that right?
Most definitely. We found that to be beneficial to both our youth and our seniors, and we wouldn't deviate from that focus of our work because it works for our youth, it works for our seniors. When we first talked about it, we sat down with our youth and our seniors, and I'm gonna be honest with you, in the beginning, neither one of them wanted to work with each other. But I'm gonna tell you, along the years, it became the best, like the best marriage. And it also brings about community unity to me. It brings unity in the community.
Excellent. I love that. We also had a question from Michelle Dunaway asking how seniors can get involved with your programs.
All you have to do is send us an email or call, and ask us exactly what they need. We'll be starting our homemaking project again, but we also are working with the Department of Children and Families, and they are, when we refer our seniors or our youth to them, they also assist us with case management support, housing, grocery shopping, or anything that the people that we work with need. So that's been a good partnership that we just developed over the last couple of months. So we're excited about that. So just give us a call, send us an email, let us know what your needs are, and we'll be there to support.
Thank you. They're also, Juanita, if you'll check the chat, Phyllis is requesting that you reach out, and her info is in the chat for you.
Okay, Phyllis.
All right. Any other questions for Juanita? Daisy?
I was just checking the Q&A chat box, but there's none there. Thank you so much, Ms. Suber, for your presentation. We do appreciate all the great work that you're doing in Pinellas County. Thank you.
Thank you.
Okay, so our next presenter is DeAndre McKay from Salvation Army St. Pete.
Hello, how's everyone doing?
Oh, there you go. Good, how are you?
Great, great. So over the last, couple of years, our shelter program has been supporting individuals and families with meals when they've needed them the most, provided many with financial assistance during multiple occasions where one has witnessed some form of a hardship, and provided shelter to those in need of love, support, and a hope for a better future with Jesus. So as I go through multiple of the bullet points listed here, we tend to look at homelessness as being just that key point into one's journey where we're trying to get them to housing, which is the destination. So we look at what they're going through as a journey, and then the ultimate destination being, where they want to be, which is permanent supportive housing. So our approach here at the Salvation Army St. Petersburg Area Command is we currently have 2 case managers. One is specializing in mental health, and the other specializes in DV, at risk, and the homeless population. And typically, the way we do it here is after 14 days, those who are appointed case management, they go through various stages where we love to highlight strengths, weaknesses, whatever the barriers to housing are. Being that we're a 90-day program, we tend to set goals for 30 days, 60 days, 90 days. And alongside of case management, we have weekly housing search and activity logs, which coincide with our one-stop resource center. So Tuesdays and Thursdays from 9 to 11, we have our job application center where we help with resume building, team activities, and pretty much anything revolving SNAP benefits, helping someone get Social Security, disability benefits. We also offer near our one-stop resource center on Mondays our shower ministry, which we open up to community to provide those clean clothes, towels, and someone that they can bathe. That's going on normally from 2 to 4. We look to expand to a second day throughout the week, so possibly a Thursday. Also in our one-stop resource center, we have over 100 individuals who access the mailing center. So they do not have a permanent address, so we allow them to use ours. And that also helps with us being a point of access for, them to get whatever mail they wish to receive. When it comes to the one-stop resource center and job training, on the flip side, we work alongside AARP. And what we do with AARP is we work very closely with those, get them trained, and after X amount of hours, we look to bring those individuals on board as full-time employees. So we have multiple AARP trainees who, after I would say around 400 hours, we typically offer them employment and wherever they specialize as they're doing the on-the-job training. Our daily meal service, we're serving 3 meals a day to our residents and 1 meal specifically for a community. And that's normally the lunch servings. Our food pantry and clothing vouchers. So our food pantry is open Monday through Friday, 9 to 4. We offer utility assistance on Tuesdays and Thursdays from 9 to 11:30. And clothing vouchers are Monday, Wednesday, and Friday, 9 to 11:30. So I'm not going in any shape or form as far as what's listed here. But computer access, phone usage, as long as an individual agrees to our computer usage policy, we're pretty much open to the community. And that's for resources to come in. Also, our one-stop shop is to come in and make sure that you leave here with more resources or information that you come in with. And as far as our emergency shelter, we're currently at half capacity, and we wish to open up our shelter in about 2 weeks. So right now we're at, as I mentioned, half capacity, but we were waiting for our second case manager to go through onboarding, HMIS training, which she has, and we will begin to accepting individuals and families. That way we can reach our maximum and be able to provide all the services that we wish to the community. So I'd like to open it up right now for anyone who has any questions, any comments.
Thank you for that. I do have a question. How much extra shelter capacity will you have once your case manager is fully on board?
So we currently have 46 individuals, 42 are males, 4 are females, and I believe we have room for about 52 individuals.
Okay.
There is
And you
also
said families, right?
Yes, so our families were currently filled, but we have
Okay.
some openings in the next week or so.
Okay. Thank you.
There are a couple of questions. There are a few questions in the chat. David Hassett at WestCare is asking, is this a walk-up situation? Sorry, I'm not sure which part.
Yes, so for those who walk up or either call in, we're just redirecting them to a specific time frame that they should check back with us. But we love to get the information that it's going to be approximately 2 weeks from now, in which we open back up those beds, at least allowing the case manager some time to get settled in with her caseload and undergo all of the HMIS training. So at least 2 weeks from now, for those who will be walking up, we will be opening our doors to them.
Excellent. Lauren Smalls is asking, what data is needed for help with utilities?
So normally when an individual comes in seeking utility assistance, we just look for a form of identification, a government valid driver license would work, and also a form of residency. I'm sorry. So we normally go off of a valid lease, and that's what we use to give someone access to our utility assistance, and that's also followed by a recent bill, just to make sure it's in their name, they're the account holder. And then, of course, if they've never been here, they have to go through the whole intake process. But that's normally what you need.
Awesome, thank you. There is, DeAndre, in the Q&A box, which you can see, a request from Erica with Pinellas County Schools HEAT team to reach out regarding the referral process for families with school-age students, and her contact information is there in the chat. I can also send that to you afterwards. Do you want to talk about that referral process at all while we're here?
So we are a low barrier shelter, as far as just to address as far as anyone looking for emergency shelter. And then our families, they're coming directly through the 211 shelter prioritization list. And that's normally how we, choose based off of how serious the individual situation is, but that is our referral process. So a lot of times when people call in, we're redirecting them to 211, in which they'll be put on the shelter prioritization list, and we'll pull from that list.
Thank you very, very much for answering that question. And for anybody who's on this call who is unfamiliar with what DeAndre was just talking about, there is a shelter prioritization list for families. Families in Pinellas County can call into 211 Tampa Bay Cares to be placed onto that list and to be prioritized for shelter. And that is the front door access for family shelter in Pinellas County. And then we also have a question from James Hoskins. What number do adults call for housing openings?
So our main line will probably be the best because we're great at redirecting the calls, but our number is 727-550-8080. I think it's pretty easy, but again, it's 727-550-8080.
Thank you very much. And then Michelle Dunaway asks if there is a way we could add a list of times per programs. And Michelle, I can assure you that we will send out some information about the meal service and the one stop in an email after this. But outside of that, DeAndre, is there anything that you would like to say about times or where maybe publicly people could find this information?
Yes, I would say the best way to find out is just to come on down. I would love to meet you all, give you guys a tour. I think is very key.
Wonderful. Thank you very much. Joy Reeves is asking if folks have to be experiencing homelessness in order to receive services at Salvation Army St. Pete.
Well, for emergency shelter, yes, but for all other services, no. And we work on a case-by-case basis, so some documentation is not needed for some services, so it's best to just come down and speak with one of our case manager specialists.
Thank you. And then Linda Wellborn is asking, what is the maximum amount that you can help with for electricity?
So to be fair, $250 per individual is currently where our cap is. And anything above that it's looked at on a case by case basis. So we're looking to provide everyone fairly, and that's $250 per voucher.
Thank you very much. Elizabeth or Liz Brock is asking if Salvation Army St. Pete has veteran-specific priority for housing.
Yes, so we actually have contract beds and case manager specialists designated for 3 shelter beds. So we do have those services, but currently our services for those beds, they're filled, and they're normally, when we have someone graduate from the program and move it to permanent housing, we have that next spot filled because we have also these individuals being referred over from our healthcare system, which is Bay Pines and Baycare.
Excellent, thank you. Joy Reeves is also asking how folks can get case managers to help with permanent housing if they have Section 8 or housing choice vouchers.
So our case manager specialists, they're already equipped with, we would call it a toolbox, in which they've already reached out to community partners and made those relationships with agencies such as BOLI, VOA, which offer their low income properties. And what we're doing here is once that individual is provided case management, they're provided with a list, and they're also provided access to the resource center where they have the one-on-one training with case manager specialists on how to apply for jobs and how to apply and look for housing, whether you have a voucher or not.
And then DeAndre, if you can answer this, if not, I am happy to. Somebody is also asking if your case managers are able to help people enroll in Section 8 or housing vouchers.
Yes, they are, but they're only helping the residents. So a lot of times we have walk-ins who are not a part of our emergency shelter program, and our case manager specialists are not helping those individuals, but they are getting that help from our one-stop resource center team.
Thank you very much. I will also add to that just so that everybody who is on this call knows vouchers are provided generally through the housing authorities. There are 4 of them in Pinellas County. There's the Pinellas County Housing Authority, the Tarpon Springs Housing Authority, the Clearwater Housing Authority, and the St. Pete Housing Authority. And then I will go ahead and Joy, I will send you DeAndre's contact information, and I will send him your contact information as well so that you can get a little bit more information about how he can maybe, or his team can maybe assist you and your network. Absolutely. Are there any other questions for DeAndre right now?
No, just a comment. I would love to schedule a tour with you.
Absolutely, let's set it up.
Yeah, I'll email you after this.
Fantastic. Thank you so much. Really appreciate you being here, DeAndre.
Oh, I appreciate you guys. Thank you so much for everything that everyone's doing to help us.
Yeah, thank you. And thank you for your presentation. Okay, so our next presenter is from West Care Turning Point, and the presenter will be David Hassett. David?
Hi.
Hello.
I am going to go over how our general program works, and then I'll leave it open for Q&A. West Care Turning Point is an immediate receiving shelter, specializing in the homeless population in Pinellas County in Tampa Bay region. We generally, what a typical stay for a client looks like is once they come in for screening, they will go through an intake process, which will find out what their needs are. They get an orientation typically after the first day. During the first 3 days, we call it the diversion period. The diversion period allows for them to be observed for any biomedical conditions that might need for the evaluation once the substances wear off. That's typically ER setting, or if they need PCP care. That's generally the first 3 days. After the first 3 days, clients are allowed to go into a bedroom and they're assigned a case manager. That's really where the starting point is for the clients. The case managers at Turning Point, I and another case manager are typically assigned half the population. We help clients for documentation readiness, job local leads. Typical things that clients come in needing is ID and blue card. So we also established that. After the first 14 days, the clients are allowed to leave to go look for work. We do have general pay phones. Typical in the past they cost. We just recently converted over to free phones. So it's reduced the barrier of them not being able to make phone calls if a case manager is not available, or after hours when typical staff aren't there in the case management department and it's typical text or peer support. Clients at Turning Point typically get case management, peer support specialists that teach relapse prevention skills and life skills. They get that typical 5 days a week, and then Saturday and Sunday is really flexible. We do have H&I 7 days a week, and some local members in the community that bring in AA meetings on the Saturday and Sunday. We do provide them 3 meals a day. And then after around the 21st day to the 30th day, that's really where we plan the discharge, whether that's to transitional, shelter option, or treatment. Turning Point can evaluate them and get them to the right level of care. Typical clients that do treatment, we refer out to ACTS or the Cove or any other Operation Paul or any other treatment provider by providing them a psychosocial assessment. That's the one unique thing that Turning Point can offer is we'll take them into an intervention level of care, provide the services that they need, not just documentation readiness, but any assessments that they might need. We also do coordinated entry. I'm one of the assessors. We'll place them on a coordinated entry list. And depending on how the client's length of stay goes, they'll either go into a rapid rehousing treatment, transitional, or a shelter option. Typical things for clients to come in is always the hot question. So that I kind of left that for last because it's more of a flow how we screen them. Clients can either take a phone call in via phone or walk up. Now I always suggest them to call ahead only because that allows us to kind of get an idea of what we're dealing with, but I understand that that's a barrier on its own. So typical things we're looking for: clients that are homeless or have been using within 24 to 48 hours. If they come in from a local ER or they're being evaluated for a 52 hold, those are cases typically escalated to me so I can just make sure that they're clear to come into Turning Point. But it's really smooth transition at that point. Any medical conditions or mental health conditions are the big ones that kind of get a client a yes or no. Because of our level of care and the state standards and accreditation standards, I have to have any client that have a biomedical condition such as high blood pressure, diabetes, seizures, COPD, asthma, heart conditions, mental health issues, or on blood thinners. They typically need some type of medication. Now for mental health, it really depends on how mentally stable they are. It just allows us enough time to get us on them on blue card and them to see their PCP. But the first 14 days, a client basically would have to go through the withdrawal plus their mental health, and it sometimes is just too much. Turning Point really doesn't try to flag clients. And that's one of the premises on why we're so stern on the medical conditions, because we want to make sure that we're not setting them up to fail, just to get them in the door. Which is why we also require the medical supply 14-day medication. Depending on the situation, if I'm able to work it in, I can do that. It really just depends on what I have access to. I know some who know Turning Point we get a mobile medical bus Tuesdays and Wednesdays from Evora Health, and they help with the general PCP referrals and any medications needed after the 14 days, or enough to get them onto Blue Card in the health department. Or sometimes we'll get them on health insurance or work with their Social Security to make sure that their Medicaid is intact. Any questions so far?
Yeah, this is Joe, Pinellas Hope. Thanks,
Hey,
Dave.
Joe.
Yeah, and you guys are very helpful to us when we have people at the shelter that have been struggling with substances. If we can get them, after we assess it, and if it looks like they need some more structure, we've sent them to you, and if they complete a period of time with you, we take them back, and that's been successful a few times. So I appreciate that.
Yeah, likewise, and that's kind of something I kind of want to add is that I know Turning Point, Safe Harbor, and Pinellas Hope are kind of like the three pillars of the long-term shelters. And we really try to all work together. And I know that some Pinellas Hope is hit with, like Joe has said, a lot of the clients that either need a higher level of care or Social Security, and that's kind of where Turning Point has hit our barriers as well. Is we can assess the clients for their needs, but getting them into like an ALF or something along that line, it's a lot more than just one program, because it takes a village, really. And I do appreciate the work that you do with those the long-term clients, that especially that they come from us, because without Pinellas Hope or in general Safe Harbor, there wouldn't be a shelter to hold them.
Yeah. If we send them to you, it's with the understanding and the expectation that they'll come back to us if they complete your part, completely. So that's
And we really try a couple things with clients that come in. Thank you for going to the next slide. We do half-size lockers. I know from people who've known Turning Point, we used to do bins. We got rid of all our wooden material, and we got half-size lockers. So really a week's worth of clothes. We really try to get what they need. And then when we start to transition them out, we have a better idea of where they're going, because if they go to treatment or they're going to Pinellas Hope taking too much stuff, or another shelter in general, it's better than not to just get the stuff and then throw it out.
I have a quick question though about methadone, because I know they can't leave your facility for the first couple of weeks, I think, when they're there. Do you
Yeah.
take people who are on methadone, recovering from
Yes.
other drugs? And how do they go about getting their methadone? Do you let them go to the clinic to get their methadone?
So I'm happy you brought that up, because I get asked that a lot. So we do have access to, West Care wide, we do MAT, so clients are allowed to obtain medicated assisted treatment. For the methadone option, I know Operation PAR is the larger provider in this area. There's two options. I've seen it in the past, and it's very rare. I've been there about coming up on 5 years. PAR will issue Medros packs and issue it to a secure provider, because we have the area where it's on lockdown, and we follow the 65D standards and CARF standards for operation of narcotics. And that has happened. I've been there 5 years. I've only seen it twice, and it's usually the provider will call our nurse, verify that we have a secure lockup, that the client's coming in, this is the client's appointment time, and they do a secure transfer. It's very rare and very hard.
Do they already have to be a client with Operation PAR to get that done or?
No, this is the second way I've seen it. As long as I've had a provider like from an ALF or an ER prescribe it, and as long as the provider knew that they were going to a secure location,
Okay.
they did a transfer that way. The reason why you have a hard time finding providers to do that is, like you said, it's a daily setup. But those are the two options that will allow us to treat them with methadone. If they have a provider that will issue enough for 14 days, and then they would go out on the 14-day and daily dose after that, or however their provider does it, because I've done that before where they'll bring in enough for 14 days, and then after that 14 days, that client had a daily
Right.
go to the office
Right.
and
So
dose out.
what I'm hearing you say is like if it worked out good, like Operation PAR would send 14 days of medication to you, so you could dispense it daily to that client. And then
Yes, under the 65D rules.
230,
Our
yeah.
behavior health techs are med techs.
Yeah.
So we've
Okay.
gotten our staff med
Okay.
tech certified, so we're allowed to administer instead of the observation level. But like I said, it's really hard. I've only seen it a handful of times, and it's
Okay.
typically done through the provider to LPN because the provider wants to know that there's a nurse on staff, which we do have one. And then coming up in October, we'll be adding a weekend nurse that's coming up in the work. So on the weekend we'll have our LPN 7 days a week instead of just 5 days a week.
Okay, if that comes up, I'll definitely reach out to you and see if it can work out.
Yeah, and if
That's
and we could and if you had any questions, I can also connect you with the PAR contact that I have.
Mhm. Sure.
And typically try to see if they can work something out.
Great. We'll cross that bridge the next time it comes up. So thank you.
And there was a question about confirmed type 2 needles, meters, lancets. So any type of diabetes, the issue is with diabetes is even diabetes, if they're not insulin dependent or use a meter, there's no way for us to check their sugar if they don't come in with that. So if a client that isn't use a meter in general, if their sugar drops because of their drug use or a medical condition that was masked by their drug use, there's no way for us to know. And if that happens, and they pass out or stroke or whatever the case might be on our property, where it's at risk of us losing our license because we'll be in violation of CARF and 65D law. I hope that answered your question, Michael. Any other questions? I appreciate your time. If you do have any particular questions, you can always reach out to me. Katrina Tucker, who many of you might know, she's the program manager. I typically handle the day-to-day stuff, and if anything I can't handle, she'll step in. But she has allowed me to step in to help with general questions and program issues.
Wonderful. Thank you so much, David. This was really informative. I didn't see any questions on the Q&A box. I don't think you answered the ones on the chat. Let me see. Oh, there is one here. David, what is your capacity? From John. I think you're on mute.
I'm sorry, I muted myself.
It's okay.
We're licensed for 65 clients. Typically in the past, we used to do lineup. We don't do that anymore. We do the phone appointments, but we do allow walk-ups. But because of COVID, we really haven't seen more than 45, 50. I'm assuming things are going to change with October's laws coming in. But I'm sorry, my cat is not cooperating. And as for the question, mind providing couple things like barriers, so as we all know, clients that are on medication sometimes either lose their meds, get wet, sell their meds. That's the biggest barrier. I actually could tell you I had a client that we wanted to take in, was able to come in, was prescribed his high blood pressure and mental health 4 days prior to our appointment, and because he just filtered on his Medicaid and only had 5 days left, he only had enough of high blood pressure meds to get him through one day. Which the issue of that is Medicaid is not going to pay for an emergency dose. You would need a hospital to issue an emergency social work voucher that's paid through a social worker. And that would have to come out of an indigent fund that the hospitals have access to. And it's not that easy just to get access to that. There has to be a need and a care, and it has to be a social worker signing off on it. So that would be an example. And you also need, because the social worker can't prescribe the med, you would need a doctor to issue that order, then the social worker to process the paperwork. EpiPens, that's another issue. If a client has a food allergy and they can go into anaphylactic shock, EpiPens are not cheap. And if they haven't or seen a PCP in general for an EpiPen, you're gonna have to find a doctor to prescribe it. So the biggest barrier is medication. Sometimes the client, our criteria is homeless and substance abuse. So sometimes that might be a barrier. If they're too far outside our window, I can't take them because of our funding sources. And Central Florida is our biggest funding source, and Central Florida has a level of care that I have to follow under the ASAM guidelines, which is tied into 65D law and then COF accreditation. I know I said a lot. It's kind of like a mouthful. They've kind of shoved it all down my throat.
No, you're
So
good.
I try to
Thank
just
you.
keep everyone up to date. I'm very passionate about Turning Point. Turning Point is a very special project. And my goal is to help reduce any barriers I can on my end, and any barriers that the clients come in, help provide them enough information so if they utilize another shelter or another transitional unit, they can easily get that information without being shuffled through the mix.
Thank you so much, David, for that information. And thank you for presenting on behalf of West Care. And I think Turning Point is a really great program. Can you post your first initial slide, please? Yes, we can get back to that. So I just wanted to thank everybody who presented today. We do appreciate all of the presenters. I think it's really great information, especially for everything that we're doing in the community, where there's always a provider out there that we may or may not know how to get a referral, how to get in communication or in touch with. So I think it's really important to have these info sessions because it's a great opportunity to ask questions and to really get to know what all of our community providers are doing. So thank you very much for that. If you didn't have an opportunity to ask any questions, now is the time to ask a question to any one of our presenters. If you want to put something on the chat box, that's fine. That's okay. If you want to come off mute, raise your hand. We can also do that as well. So this is, we have a couple of minutes if you have any questions for us and the presenters. Do you see any questions on your end, Victoria?
I do not. Just some thank yous for some great information.
Awesome. Okay, well, if you don't have questions right now, we're open to public comment. And if you want to share anything, raise your hand, come off mute, type it in the chat. This is your time for any public comment.
I do have a comment. Well, actually, excellent. I mean, this is the first time I've joined this group, so thank you for this wonderful time. I do
Great,
want to know
welcome.
if there will also be, along with the delivery of this presentation, will there also be a directory of those participants?
So all information shared during this meeting will be emailed to everybody who registered, as well as all of the COC and HLA's members and supporters. The information will also be available on the HLA's website, and we will share this recording on YouTube. So every material that we've gone through, contact information, so long as I have permission from the presenters to share it, and websites and flyers and a PDF of today's presentation. All of that will be made available following today's meeting. And we also have on our website materials from February, March, June, and July. I'm missing one. We've done, I think, we've done 5 so far. So we have all 5 posted on our website, and the follow-up email will also have a link to those resources as well. So if you've missed our previous COC info sessions, don't worry, you can still watch the recording and get all of that information as well. Thank you very much for asking, Robin, and I sincerely hope that answered your question.
It did.
Okay.
Excellent. Thank you so much.
Absolutely.
Excuse me, good evening, everyone. I have like a little bit tricky question regarding my situation. Me and my family, we were moved from Ukraine because of war affected us, and we created in Pinellas Park, we created as a shelter. It's a residential care facility for 50 residents, and as of today, we're helping refugees, like people, non-Americans who were affected by war. And I have a tricky question. Are they like homeless people, or it's another direction for to collaborate with you guys?
So you would like to join our COC membership as part of to provide the services that you're having right now? Yes. Okay, great. So Victoria could definitely help you with membership. She can go over all of that information and how you can join our COC and with whatever services you're providing, and also the categories or the type of services you're providing for what specific population. So we could definitely get that information out to you.
So
and thank you for joining us today.
Sure, with pleasure. So you do have members who are dealing directly with the refugees, am I right?
Yeah, so our COC membership includes individuals who are members of the community, service providers, elected officials, local businesses, faith-based organizations, all working together to try and end homelessness. That doesn't just mean helping people who are actively unsheltered. It does mean, of course, working to keep people in shelter. So a big part of what our system focuses on is, of course, trying to help people achieve stable, permanent housing, but also staying in your home. A family that has lived in their home for years and has gone from 2 incomes to 1 should not have to uproot all of their children while dealing with tragedy, if that can be avoided. So we call that homeless prevention services, and that is a big part of what our continuum of care does. And what many of the services available here in Pinellas County are all about. For instance, the utility assistance that DeAndre mentioned through Salvation Army earlier today, that is absolutely a homeless prevention service. And we want to make sure that those services are available to assist people experiencing homelessness and people at risk of homelessness. And we want to make sure that our COC members are people who have that lived experience of homelessness, have the expertise of, being service providers and funders, or are members of the community who just want to help make a difference in our community and help our entire community be a happier, healthier, better place to live. Great question. Thank you very much.
I think there was a question on regarding of where your location was, your services. Was it in Pinellas Park?
Yes, we are at 7575 65th Way North. I would like to share information about me and my parents.
Sure.
Yeah. Anna?
Yes.
Hi, this is Meg, and I'm actually at the library. It would be awesome if you could come by sometime. We have a lot of information that we can put you in touch with. We work with some refugee groups as well. And we've got a welcoming week that's coming up. So yeah, if at all possible, my name is Meg Taylor, and I'm here at the library.
Yeah, you're so close.
We're just right across the street from the the city hall.
Okay. With pleasure, Megan. Thank you.
You. And Anna, if we have your email information, we can definitely reach out to you and can get you connected with some of the resources that we have as well. Thank you. I think there was sorry, go ahead, Victoria.
Go right ahead, Daisy.
I was going to say there was a question regarding how to join the CoC. If you go to the next slide, there is a QR code there with our information and also our website, where you can get some more information regarding membership, and also Victoria's email, or you can reach out to me as well. We can definitely get you that information regarding membership.
Wonderful. I also want to let everybody know that you may have seen an email about this, but the 2024 point in time or PIT count report is now available. And that report provides a snapshot of homelessness within our community. In January, approximately 400 volunteers went out and surveyed our neighbors experiencing unsheltered homelessness. And from that report and from those efforts, we know that there are at least 2,110 individuals experiencing homelessness in our community on a given night. Of those individuals, at least 721 are experiencing unsheltered homelessness. There is also a lot of information in there about school homelessness, about demographics, people in Pinellas County jails who did not disclose a permanent address when they were booked into jail. So please take a look at that. Dawn was kind enough to post a link in the chat. That is pinellashomeless.org/ oh, sorry, that wasn't the right link. I was looking at Dawn. I'll post the right link in the chat. It is pinellashomeless.org/PIT data. And you can go on there and you can see all about the 2024 point in time count. And if you have any questions about that, please don't hesitate to reach out. That's all, Daisy.
Sorry, I was reading Mark's comment on the chat. Mark mentioned, would it be possible for me to receive some information on what we as a community have come up with as to what we can do to break through the barriers that cause the distress from those who are passionate, from those we are passionate serving? What kind of information are you looking for as far as just how we're coming together as a community to continue to work on our system of care and how we connect clients to services? Is that what you're asking for, Mark?
So yeah, basically that's exactly what I'm looking for. I'm kind of new to the community, and I'm just starting my nonprofit organization, and so I just want to know like what barriers are everybody seeing as far as like getting our most vulnerable people through the process into like self-reliance and that kind of thing. Like, is it like the initial, because what I found when I was in California, when I was part of the CoC in Riverside, is that initial engagement is like it's the most integral part of the whole process. And it seems like sometimes from that point until they actually get to be able to sit down in front of somebody, we can either lose them through, they just transition to some other, community, or drug overdose or things of that nature. And it's like, what can we do? That's kind of like what a barrier that I saw that was in the county then. So then, we came up with hotel vouchers, and then we started utilizing them, and they were better. We got to get these people, and we didn't lose them in the process. So that's what I'm kind of looking at.
Yeah, I would say that our Pinellas County coordinated entry system and just our system in general is pretty robust when it comes to having clients access our services. We have a really good outreach team that have great communication with our coordinated entry system, with our shelter providers. I think we continue to improve that also because of this anti-camping bill. We have this task force group meeting, work group that meets on a monthly basis, sometimes twice a month, to really look at system gaps and system barriers that we can improve on. I think one of the things that we can look at is the referral process. Sometimes, as you heard, some of our providers are at capacity, or we're trying to figure out how to move our clients out of a shelter program into a more permanent supportive housing, or any other supportive housing that we can think of. So I think that could probably be a barrier, is also looking at other providers that can have more capacity to take on some clients and also exit out clients into a permanent housing situation.
Great. Yeah, no, thank you very much for that information.
Yeah.
I understand that. And it's always, funding sources are always they can themselves be, be a barrier in some cases, in my experience. So, but I think that, we do the best, we can with what we have. And I know that we're doing that. And I just want to kind of see where I can fit in and provide, because it's just in the start. I'm just starting. So it's going to be outreach for me, and it's going to be linking. So it's going to be important for me to get, with service providers and get some partnerships and things of that nature. So thank you very much. I'm glad that you had this. This was very informative. Thank you very much.
Sure, you're welcome. Thank you for joining us. Do we have any other comments, concerns, questions, anything you want to share?
West Care is doing a Narcan event, a drive-in Narcan event, at the end of this month. I think I sent out some flyers. I think I can post it. Well, can I send it out to you, Victoria, and then you can send it out? Okay.
Yes.
Absolutely. I will send, you already sent it to me, so don't worry. And I can send that out in the follow-up email as well.
I'm gonna send you a new one. The one I sent out, they of course updated. This one has a how to administer a QR code, or how to administer the Narcan as well.
Wonderful. Thank you, David. Okay. Well, again, thank you for everybody who presented. Thank you for all of the questions. Thank you for the new members who have joined us today or this evening and listening into this info session. Like I mentioned, this is really informative. It's really critical that we continue to do this, to share the information that we have within the community. And also it's a great opportunity for you to have a real conversation with the providers that we have in our county. So again, thank you so much for joining. Did you have anything else that you wanted to say, Victoria? If not, then we can adjourn for this evening.
Thank you all very much for joining us. Be on the lookout for the email with resources shared today. It will also include resources from all of our other CoC info sessions this year. And if you do want some additional connections that were not made here during this meeting, please don't hesitate to reach out. That's what the CoC is all about. So we are happy to help make those connections. Thank you all for being here.
Thank you, and have a good evening, everybody.